My name's Bill Sullivan. This is Oakdale Animal Hospital. We are a small animal veterinary practice. We have 4 doctors here pretty much all the time that see dogs and cats, companion animals that you would have in your house. We primarily deal with internal medicine issues, surgery, a lot of imaging. We deal with most problems that you're going to encounter with prevention of health problems in your pet and emergencies. So we're kind of a full service veterinary clinic. We have a support staff of probably around 20. We have some licensed veterinary nurses, about 8 of them. So we stay pretty busy. We keep a full docket. We've been here about 15 years, and over that time we've learned a lot of challenges, especially with IT issues and with the flow and with just being busy. So we have 11 stations that are our computer stations that we are tied into our technology app. We have an operating system that manages us and lets us integrate in an integrated way at all of our records, at our lab work, at things that are at labs that aren't even arrived here yet, results that haven't arrived here yet. Imaging from especially radiology, but we have the ability to send remotely images wherever we need to send them to, and all that's tied in in a central way to each one of these stations. And it is a lot of moving parts, but it really makes our access to information remarkable, and we can sit down and in a very organized way have a really big picture of a situation with someone's pet, whether we need to go to surgery now, whether we need to wait, what we need to treat with, and how we need to communicate with that owner. It also is part of our billing process. It's part of capturing charges. It is our technology at these stations is key and integral to our success at what we do. So the challenges with our technology were that we had, probably the best way to describe it is competent but marginal IT help, because they've done many other things in small businesses, but they probably didn't understand some of the things in a practice setting and some of the needs and the speed that we needed things corrected, and the domino effect when one technology falls down on us, how it hits a lot of the other ones too. And so it was really frustrating. We were probably putting too much burden to get some of that rolling on our staff, and our staff took a lot. It began over the years insidiously and slowly started to just pull away time from our staff. And as you sat back, you look and you saw, wow, this is really inefficient. We reinvented this wheel probably, and it was not working. And I knew there was people out there practices that had this managed well, and I wanted to be one of them. After we hired the solution team, probably one of the big things was bringing them in and letting them help us understand what they were going to do, so we knew what they were here for and what they weren't here for, and that defined things really well. That made me feel really good. What they did for us, they freed my staff up. They allowed someone to come in and say, man, we've got this, and they understood some of the challenges associated with imaging, with the need for these simple things like the need for a printer and all our printers to be working seamlessly, and for us to be able to retrieve things from our operating system, the ability to work with our management software company and understand what they were telling them to do in a practice setting. And I think they had the experience to do that, and it showed as we got started. We are a veterinary practice, but not much different from other practices, whether they be medical or dental, emergency, critical care. Some of the things are the same, and their ability to do that really showed that we would fit in with what we needed and what their skills were. to a practice that is considering using the solutions team, I would say especially if you're getting to the point that you really need to utilize all your staff really, really well, to leverage their abilities for what you paid them for. You need to think about what time you're spending on your IT and all of that takes up time. And I would say that if you'll look at that and then you turn around and maybe look at where they've worked before and what they've done for these folks like us, it will be a really easy decision. I really believe that people that are good need to come in and do what they do, and you let the people that you have that are good do what they do, and it's just a win all the way around for us. It's been for us, and I think it's been for the solutions team. I think it's been a good partnership.